The honking of support is constant in Bromsgrove.
I thought people were going to hate us. People were going to say, "You're nurses, for goodness sake, what are you doing?" But I think most people, the majority of people, understand and support us.
For 106 years, members of the Royal College of Nursing have never staged a strike. Today is the second walkout in less than a week.
How's it got to this? How has it got to this? It's just heartbreaking. Our profession is breaking. The NHS is broken and our profession is breaking alongside it, and that's heartbreaking.
Yeah, there'll be people at home who will say, well, you feel that passionate about it. You've walked out on patients today.
Yeah, but what about the other 364 days of a year? And you know something, the RCN have supported and made sure there are enough nurses to cover inpatient settings and community settings. But what about the other times? So every single day of the year there aren't enough. Patients are being put at risk.
The RCN is asking for a 19% pay rise. The government's offer is, on average, around 4.7% in England and Wales. They'll negotiate conditions, they say, but not a penny more on pay.
I'm so upset that they won't even talk to us when we think of everything we've gone through in the pandemic. We looked after Boris Johnson, we saved his life, and they won't even discuss pay with us.
Questioned by the Commons Liaison Committee today, the Prime Minister said he understands how tough it is right now, but he's still not budging.
I've acknowledged that it is difficult. It's difficult for everybody because inflation is where it is, and the best way to help them and to help everyone else in the country is for us to get a grip and reduce inflation as quickly as possible, and we need to make sure that the decisions that we make can bring about that outcome, because if we get it wrong and we're still dealing with high inflation in a year's time, that's not going to help anybody. I don't want to see that. I want to see things get back to normal, and that's why having an independent pay process is an important part of us making those decisions and getting them correct, and that's why we've accepted those recommendations in full.
Tomorrow, things get tougher still, with tens of thousands of ambulance workers walking out from 9 trusts across England and Wales. They'll still respond to life-threatening situations, but the government has suggested people should avoid contact sport and unnecessary car journeys just in case. Even before the strikes start, though, 5 trusts, including Yorkshire Ambulance Service, have declared critical incidents today, and paramedics say, such as the stress the system is under, you might not notice any difference tomorrow.
The strike days, I don't think are going to be any more dangerous than today.
Why not?
Or yesterday.
Why?
Well, simply because the number of cases that we can't respond to seems to be ever increasing. We're stuck at hospital, unable to offload patients because the flow of patients through the hospital has been severely affected by government choices.
Ambulance staff say they are not asking for a 19% rise like the RCN, but say they need more than 4.75% and desperately want the government to negotiate.
I think if the government were happy to negotiate on pay, if they were happy to talk to us on pay, there'd definitely be room for negotiation.
The NHS Confederation has warned the government they cannot guarantee patient safety tomorrow. Today, though, from Leeds to London and at trusts across Wales, Northern Ireland and England, there is no sign of nurses backing down, even if choosing a picket over patients fights against their every instinct.
I cried. It got to tea time and I was hoping that the decision would be overturned and that we wouldn't need to take industrial action. I cried, and I'm not the only one, and I talked to all my colleagues, and all of us were very tearful and very upset because this isn't what we wanted to do, but we have no control over it now, so we've got to do it.
Several NHS trusts have tonight declared critical incidents amid significant pressures that right now look set to continue well into the months ahead.
Well, earlier I spoke to Pat Cullen, who's General Secretary of the Royal College of Nursing, from a picket line in Leeds, with the Prime Minister vowing to stand firm against what he calls unreasonable pay demands for months if necessary. I asked her if they were prepared to dig in for months too.
Well, I've said today to the Prime Minister directly, he can make this the last day of strike if he does the decent thing and gets into a room and starts to negotiate on behalf of the tens of thousands of nurses that we represent. And we can start this new year, in fact, probably the last full year before an election, with no strikes.
You've said that to the Prime Minister directly. That's your message, or you've had a phone call?
No, I'm saying it to her directly. I haven't spoken to any government minister now for a week. They brought me down to one of their offices last week, told me their door was always opened, arranged a meeting with me, brought me in full of optimism along with my colleagues, thinking that I was going to be able to avert this strike today on behalf of these wonderful nursing staff. And when we got into that room, very quickly became abundantly clear from the Secretary of State, we can talk about anything, but we must not talk about pay. There wasn't one single brown penny put on the table additional to what the pay review process has offered these people.
Okay.
He closed his books and he walked away.
But there has been something newish on the table from the Prime Minister today, where he says if you call off these strikes, you'll get a better pay deal next year.
We need to address pay for the nursing staff this year. We can't continue to increase 50,000 vacant nursing posts. We are draining brilliant nurses from our profession, and the impact is palpable on our patients. Nurses having to leave to work in supermarkets and in other retail units to be able to earn a few extra pounds every hour so that they can pay their bills, travel to their work and keep a roof over their heads. That's no way to treat this profession. And the people that's suffering as a consequence of the government turning their back on our nursing staff are our patients, the public of this country and our nursing staff.
So you'll carry on walking out until you get what you want. You're prepared to keep this up indefinitely?
Well, it's our nursing staff that are saying that enough is enough. These people have not made this decision lightly. We all know that. So let's face it, if this government thinks that this was an easy decision for any member of our nursing staff, they need to think again. These are the very people that kept this country going through a pandemic.
Do you worry you've crossed a Rubicon now that, you know, whereas in the past the public may always have seen nurses as kind of angelic figures, potentially now you're harming patients with these strikes?
Well, look, the public are much smarter than that. You only had to walk amongst these great people on Thursday, on the first day of action, and today to see that there's hundreds of members of the public and patients coming out from their appointments and standing right alongside, shoulder to shoulder with our nursing staff and saying, we are right with you.
So you've got people honking their horns, you've got cheers, you know, you obviously feel buoyed up by that. Do you think you're winning this fight with the government as things stand?
This isn't about who wins or who loses for me. This is about us getting into a room and starting to seriously address the fundamental issues for our nursing staff. And at the crux of this is about addressing the issues around their pay. If we are serious about trying to bring the NHS back from the brink and trying to make sure that every patient gets the care and treatment that they absolutely deserve, and to make sure that we can recruit and retain the nurses we've got, then it's get into a room and start to talk. It's not about winning and losing, it's about doing the decent thing.
But if you can't get into a room because the government is refusing to have those talks on pay, where does this end? How, next time there's a strike in January, are you going to withdraw some of the services that are currently protected, like chemotherapy, dialysis? Do you escalate from here?
Well, look, if this government continues after today to do the wrong thing and keep our nursing staff out in the cold, I fear that come January, yes, we will have to continue with industrial action. Obviously, there would be more organisations included within that industrial action, and that means more nurses would find themselves participating then in industrial action.
Pat Cullen talking to Kathy earlier. Well, joining me now is Victor Adobewale, Chair of the NHS Confederation. Victor, good to have you on the programme again. I mean, we've got at least 8 critical incidents declared today in different NHS trusts and ambulance trusts across the country. I mean, this is a really bad situation, isn't it?
It is bad, yeah. It's yes. My members have been telling us that they are very worried about patients and that patients will come to harm due to both the nurse and the ambulance strikes. We've got plans in place that will prioritise urgent and life-saving care. Last week we had, 2,500 elective operations that had to be cancelled as a result of the first day of the RCN strike. And, this disruption is going to be significantly worse, more severe, with the consecutive walkouts. And that's why we've written to the Prime Minister alongside NHS providers calling for a resolution to be sought, and why we've said that health leaders feel they cannot guarantee patient safety. And I know that health leaders do not want to be in this position, but we have to tell it like it is. You're being brutally honest here, Victor. What you're really saying then, I guess, is that there may be lives lost as a result of what's going on right now. Well, when you talk about not being able to guarantee patient safety, that is the, that's another way of putting that. Terrible consequences. Yeah, those are the terrible consequences that may come out of that situation. We hope that won't happen. I don't think there's a nurse or frontline worker in the NHS or social care system that wants that. None of my members want it, but what they are saying is that they cannot guarantee patient safety. So this is really right. And this is it sounds like a desperate plea for the government and the unions to put their heads together and come up with a deal as soon as possible. Well, it's the only way this is going to be resolved, isn't it? At some point, both parties will have to get into a room and sort this out. The government and the trade unions simply can't afford this situation to drift, especially when we're faced with the prospects of further strikes in the new year, and it could go on for longer, cover more areas and services. Both sides need to stop this sort of posturing, I guess. The government needs to prepare to negotiate on pay, and the unions need to prepare to meet their commitment to protect life and limb in the face of the extreme pressures. We've got to understand this is on the back of massive vacancies that the Confed, my members, have been talking about for some time. We can't allow this to be a failure on both sides on the eve of the first ambulance strike in 30 years. And this hasn't not happened. They need to work harder. Right. We've got to avoid any chaos that would ensue in January. Victor, we're both old enough to remember the industrial action of the 70s and 80s. Because we've had relatively little, do you think we've lost the knack for having these sort of negotiations? Well, I mean, the fact of the matter is, whether we've lost it or not, we need to learn to talk to each other. At the end of the day, as I've often said, in negotiation, it's successful when both sides leave the table slightly miserable. They're going to have to get around the table. I also believe that those with the greatest power have to make the first move. And, health leaders are really worried about how people requiring urgent support that isn't immediately life-threatening, categories 2 and 3, they'll be cared for with safe staffing levels. So that's why they're saying what they're saying. So, this has to be resolved. Okay, I hear what you're saying. Victor Adewale, thank you very much indeed.